Having been a consultant for just over 10 years now, it struck me that I've actually got to know some of my patients over a very long time indeed, and Gemma is such a patient who is actually one of my first as a consultant. And Gemma was one of a group of patients who had retinoblastoma, and retinoblastoma is an extremely rare malignant tumour within the eye that generally only affects babies and small children. It's incredibly rare, and for a period of time it was treated with quite aggressive radiotherapy over about a 20-year period, and the radiotherapy was really effective at dealing with the tumours often, but there wasn't really any thought given to the damage that that could cause to facial structures, to the skin, to the bone development. And we had a group of patients that were going through life actually suffering the consequences of those changes. And I was brought into Moorfields as a consultant to bring lots of new skills in to help patients like Gemma. And Gemma had a variety of procedures done over the years. And when I saw her, she had a really inflamed eye socket. It was difficult to fit an artificial eye. It was very hollow. It was very red and angry. There have been lots of surgeries there in the past. I think this is a really good example of how autologous fat transfer, which means taking fat from typically the thigh or the tummy, processing and then re-injecting it into critical areas of the eye socket, the tissues around the eye, can have enormous benefits, not just to improve volume, but also to make dramatic improvements to skin quality.
So in 1992, when I was 8 years old, I had a lot of problems with my left eye. My mum took me to doctors, got referred to different hospitals here up in Scotland. Nobody could diagnose what was wrong with my eye. I ended up getting transferred down to Mr. Hungerford at Barts Hospital in London, and he was able to diagnose me quite quickly as having retinoblastoma in my left eye. From there, I had treatment of chemotherapy and radiation, and at that point, everything was fine. Got discharged, went on to back to Scotland and back to my normal life. And then when I was 12 years old, I started having all these headaches, pains, and it turned out that I had a build-up of pressure in the eye itself, and the recommendation was to remove the eye. So they did the enucleation, and when they did that, they tested the eye and they found more cancer cells there. So that was in 1997. So again, I had more chemotherapy and radiotherapy, with my treatment split between London and up in Aberdeen in Scotland. During that time of the chemotherapy, the implant that had been put in to retain my eye socket shape became infected, and over several different surgeries it ended up being removed, which left me with a very sunken in socket. After my treatment, I got the all clear that I had no more cancer, so it was all good, but I was left with immensely shrunk socket. I was able to hold an artificial eye in there. When I was little, I used to hate wearing my artificial eye. I just was like, no, I don't want to wear it. But as I got older, I started to become less comfortable in my skin. So the older I got, the more aware I was of my eye. And I think I was at university, so I was maybe about 20 when my bottom lid collapsed and I wasn't able to hold in an artificial eye anymore. So we came back to London but went to Moorfields Hospital, and that's when I started having some reconstructive surgery. So I had soft palate grafts where they took tissue from the top of my mouth. So that was my hard palate graft. The soft palate graft was when they took it from the side of my mouth. They took some from my top of my mouth, and they also put an implant into my bottom socket to try and retain the shape. So they were able to fix that, and I was able to hold my artificial eye in, but my socket was badly damaged. There was a lot of scar tissue, and there was also, it was very red. So around my eye was red, and I had quite a lot of dry skin, which made it more obvious. So about 10 years ago, after, I think it was the implant surgery, my doctor at Moorfields Eye Hospital at that point said that there was a new doctor who might be able to help, and that was Mr. Ezra. So I got referred to him, and he had said that he could do this surgery, which was a fat transplant. So taking the fat from my stomach or my thigh, processing all the stuff out so it was pure fat, and injecting it into my eye socket. At that point, I was a little bit, I didn't want surgery, but when he explained everything and he said that because it was my own fat being injected back into me, that there wasn't going to be the side effects that I'd suffered in some of my surgeries. So when I had the implant put in when I was in my 20s, actually my body tried to reject it. So I ended up being readmitted into hospital. My right eye was swollen shut. I couldn't see at all. And it was because my body was trying to reject what they'd put in. So when Mr. Ezra had said that by putting in my own body's fat, there'd be less likely of any issues, that was one of the selling points, certainly. So it was about 10 years ago I had the first surgery. He took fat from, I think it was 3 or 4 different sites in my stomach. And that was the big surgery that we did with the fat transfers. After the surgery, most of the pain that I had was in my stomach from the transfer sites as opposed to the actual socket. There was a big pressure bandage on, so for the first week I couldn't actually see what had happened. But once we took that off, the change in my skin, in the socket itself, was quite remarkable. So a big difference there in what I used to have was skin sitting, so my bottom lid was basically my skin was sitting on top of my bone. So he was able to put in fat to build up the bottom lid so it made it look more natural. And the same with the top lid. It used to be really concave and he was able to push it out to make it look more natural. So I had 3 or 4 more surgeries over 3 years, I think it was. And then I've had 1 top-up surgery since then. And it's just to even out the appearance and everything. The surgery's made a huge difference in my life. Before I was quite embarrassed by my eye socket. I always felt like people were staring because it was so obvious that it was so sunken in. And having these surgeries has helped my personal appearance and also how comfortable I feel in my own skin. It's made me feel more confident. Whereas before I might have had my fringe covering my face, but as I've gotten older, I've become more accepting of my body and what Mr. Ezra has done for my eye socket. So hair's off the face more now. I'm just very thankful for Mr. Ezra and the surgery that he offered me. It was scary to take on a bit of an unknown surgery, but it was definitely worth the reward at the end of it. So I'm very thankful for the surgery that I received.